Hello, everyone, and welcome to the Harvard School of Public Health Center for Health Communication Creator Briefing. We are just thrilled to have you all here today as part of the Harvard Chan Creator Program that empowers an alliance between public health and creators like you. So just to give you a sense of where we're going today, we're going to start through some introductions and then spend about 15 to 20 minutes in conversation with one another before we get into audience questions. So hold those questions until the end. And everything that we discuss today will be shared in a toolkit that the Harvard team will send out after the briefing. So you'll get that toolkit in your inbox, so stay tuned for that. One more quick call out. Feel free to drop your questions into the comment section as they arise. So they'll get them in the Q&A portion. So as you're thinking about them, you can post them in there as we go, but just know that we're going to get to them at the end. All right. Also want to let you know that we have two incredible speakers that will be joining us today, one of whom's arriving a couple of minutes late. We have a little fire alarm happening behind the scenes, and so just bear with us as Dr. Williams joins us. But first, I'll introduce myself. My name is Nicole Cardoza. My pronouns are she, her, hers. I am seated in a blurry white room wearing a tan button-down vest. I have bleach blonde braids, and I identify as a beautiful Black queer woman. I am a few things. I am a writer, a speaker, and I show up in a creator role in a pretty unique way. Over the past 3.5 years, I've been running something called the Anti-Racism Daily. We recently rebranded that a few days ago to Reimagined, but an ongoing newsletter that offers tangible ways for people to address racism and systemic oppression in their everyday lives. I've been living online, perpetually online for over a decade. Most of my work has started that way and in conversation with audiences. And so I'm really excited to bring that perspective to this conversation today and honor all of the labor that y'all creators are doing. I'm really excited for today's briefing. These are the kinds of spaces I wish I had more access to when I started my career, because having these thoughtful connections between people working in the public health space and creators can create content that can truly save lives. And so I am honored that today we'll be joined by Dr. Williams and Dr. Anderson, so we can talk about how we can all empower community and advocacy together. So I'll start with Dr. Anderson. And I'll give you some space to introduce yourself as well. But just some of the highlights. Dr. Anderson is a pioneer in this space in her own right. She's CEO and founder of Race Space Inc., a fellow at Harvard's Hutchins Center, and an associate professor at Columbia School of Social Work. So thank you so much for being here.
Thank you so much for having me, Nicole. And if I can, I would love to also do the visual description as well. I loved yours so much. But I am sitting in a very bland office right now with some books behind me, but I'm wearing a yellow flowy top with some poet sleeves, and my hair is trying to curl, and my earrings are white and gold. So thank you for that, Nicole.
I would just love to hear, if it's all right with you, Dr. Anderson, how have your own personal lived experiences influenced your work? And how do you see yourself responding, from an academic perspective, to this topic?
I'm someone who really sees herself as coming from Detroit, a Detroiter born and raised and returned to for a large part of my life, because that's the space that raised me, that made me into the person that I am. So when I think about that lived experience with respect to race, racism, discrimination, I'm biracial, and I've gone through the world seeing so many things, hearing so many things that other people may not be privy to, having those conversations with, quote, both sides of my family, and depending on how people saw me or interacted with me, getting their often raw, uncovered, experience or thoughts on this issue until I step up and say, this is my background, this is what my family is. So I've really been able to hear, when we talk about this conversation, I've been able to hear in ways that some people don't. And it's encouraging to me that we have so many different ways of talking to each other right now. So as an associate professor, a lot of my research, and clinical psychologist, a lot of my research is on how do we create spaces for young people, young Black people in particular, to have these conversations with therapists and with their family. And then we took that research that we've been conducting for decades and said, well, how do we now put that into perhaps a tech space? So in industry, we've developed an app now that will allow you to be able to talk to a therapist to get some of those same messages that we might have in a 5-week program through therapy in a 15-minute app, right? So we're trying to learn those lessons, distill it, and bring those conversations that we know are effective into spaces like phones, right? And that's where you all can be so much involved in this conversation as well. So, how do we help in every space that young people are, every space that a Rihanna would go through in her life to be able to say, whether it's therapy, whether it's in the phone, whether it's on social, wherever they are, wherever we are, how can we best support young people of color to have these conversations boldly, with pride, with smarts, with confidence? How do we help them to see this fire that really is around us? It's not just an alarm, it's not just a drill, it is all around us. And we have to be able to help them see, douse it out, and to prevent it from catching again.
I mean, I'm just so grateful that you've created that space. So thank you. I can only imagine all of the challenges that you might have experienced along the way. And I want to hone in on one point that you're saying about how important it is to have a space, right, for marginalized people to be able to talk with one another. I think that we've seen that oftentimes our unique needs are overlooked. It might not be, we might not find as many solutions that are designed for us, that are culturally responsive, that are rooted in care. Obviously, technology offers a ton of opportunities to kind of to create more equitable access and opportunity. But I also think as a creator, when I'm on TikTok, when I'm posting stuff sometimes, there could be a lot of misinformation on there too. So I'm curious from your perspective, how would you recommend people to kind of navigate, and find spaces like yours that they know that they can trust?
So important to ask that question. It's the first thing that we have to do is really understand that each of us has the ability, the power to say something. We can have a voice that is going to be incredibly important for the world, right? And so we can say something. That's step one. No one should be putting the blame or putting the onus, the burden on another person. Oh, that's for that parent. Oh, that's for that teacher. Oh, I couldn't live in Florida. Couldn't be me. Like it can't be something that we just pass along down the road. So everyone can say something. The second point that you're bringing up that's incredibly important is like, what is it that we say, and how do we know that that thing is reasonable, right? Is research backed, is something that's not going to jack up this other person's life. That does require a bit of legwork. It is not something that we can just believe as soon as we see on someone else's page or on someone else's post, or a link that we've not read through, don't know the trustworthiness of it. It may take a moment or two to verify what we saw, and including the toolkit that we're dropping today, there are some nuggets that you can use that are like, oh, here's a sentence on this, here's a fact on this that I didn't know before, but now I have the language around it. But I do think that there's knowledge. So there's the what, but it goes back to me to the first point, which is that we can all and should all be saying something. And that fear sometimes is the element that prevents us from moving forward. So when you have both the confidence and the competence, the know-how and the know what, that's where to me our excellence can really shine through. And hey, we all get it wrong. I get it wrong every day. And I've studied this thing not as long as the great Dr. Williams, who you'll hear from next, but I get it wrong every day. And it's my willingness and my humanness that allows me to come back and say, I want to do it better next time. So again, I would really stress doing some of that research, clicking 2, 3 times on that link, verifying, is it coming from a renowned scholar like Dr. Williams or other folks, or is it coming from this sketchy website? Is it just coming out of the mouth of someone who hasn't done their due diligence? Maybe I don't share that, but maybe there's something like this briefing or a number of other resources that we'll be providing that will give us the what, but then how can I do that? That's me. That's the work I have to do to practice to make sure I'm ready to say it out loud.
Yes, thank you so much. The confidence and competence. I really love that perspective, and it's something that we all deserve, right? Regardless of our backgrounds, our experiences, or like our capacity to access care. And so I hope you all listening remember that for yourselves and encourage that for your communities. Dr. Williams is back with us, so I would love to take a moment to introduce him. And just as a reminder, if you're joining us a little bit later, or if you missed our introduction, we're gathered here today on behalf of the Harvard School of Public Health Center for Health Communication creator briefing, right? So this is our opportunity to connect people that are doing this work with creators. I myself, as a creator, as somebody that's creating content, encouraging people to take action, I'm just so thrilled that this space exists for creators like me. And I'm so honored to be in conversation with both of you. And so we briefly got to learn a little bit about Dr. Anderson and chat a bit about your incredible work. And Dr. Williams, I'd love to just briefly introduce you and then you'll take it from there. Dr. Williams is a Norman Professor of Public Health. He is also the chair of the Department of Social and Behavior Sciences at the Harvard T.H. Chan School of Public Health. He is known and celebrated both here and abroad for his revolutionary research on how societal factors, in particular race and ethnic identities, affect our health. And just a scholar and a thought leader and an influencer in your own right. So thank you so much for joining us. And especially after a brief evacuation, you had to literally leave the building and come back. So I'm so grateful to have you here.
Yes, good to be back inside. I got some good exercise. I had to walk down the stairs from the sixth floor, and I had to walk back up the stairs because when they said the building could come back in, there were maybe 100 people trying to get in one elevator to go back up. So it's been good, but this is life. It's really good for me to be here. Yes, you are right. One of the things I have had a burden early in my academic career was to develop measures to capture racism. Because researchers talked about the importance of racism and talked about the ways in which racism affected African Americans and other populations of color, but we didn't have good measures. And I thought we don't have the evidence. And I want to say that part of my own journey to focus on racism comes out of my own lived experiences. I remember many years ago, a few decades ago, I was working at a hospital in Battle Creek. I was a new public health educator at this hospital, Battle Creek, Michigan, where the Kellogg, it's a hospital where in an earlier version where cornflakes was invented by Dr. John Harvey Kellogg and his brother Will Kellogg started the Kellogg Company. But I got married. I was living in an efficiency apartment, so I needed a larger place. And someone told me one of the nurses in the hospital has a upstairs apartment. She's looking for someone to rent. And the nurse happened to be white, didn't bother me in the slightest. And we rented from this nurse. And about 1 week after we had been in the apartment, it was about 10 p.m. at night. We were just going to sleep, and we heard gunshots firing outside and looked outside, and there was a cross burning on the lawn. And we walked outside. Many of the neighbors walked outside. Many of the neighbors apologized. A task force from the state of Michigan interviewed my wife and I the next day about what happened. But intriguingly, there was no coverage in the local media. It was not in the newspaper. It was not on the radio. But here was something fairly traumatic we had experienced. I'll give you another example that part of my interest in this topic comes from the stress that I have personally experienced. I was now got a doctorate from the University of Michigan, was now a faculty at Yale University, needed a place to rent. Housing was very expensive in Connecticut compared to Michigan, but we found a place that was advertised, and I called the lady. It was in the newspaper about this place. The price was good, she was hard of hearing, but she said, uh, I asked her about it. The price was good, and she says, "Where are you going to be working?" And I said, "I'd be working at Yale." She said, "What do you be doing at Yale?" I said, "I'd be a professor at Yale." She said, "Professor Williams, the house is yours. There are other people interested, but I want you to have the house." I was kind of a little taken back by that. Why is she so eager for me to have the house? Is something wrong with it? But we rented. After we had been there for about a month, she told me that all the neighbors had been upset with her for renting the house to us. It was a lovely beach house in East Haven, Connecticut. Um, and it was a nice place. And but she says now they think you're okay. But she says I knew what I was doing with a twinkle in her eye because I was going to be at Yale. I would be fine. Her husband had been a professor at Yale. Her son graduated from Yale. So if you were at Yale, you were okay. But this same lady, many months later, 4th of July weekend, we had 4 friends and their kids over to our house, and we walked out to the waterfront. The house was one house away from Long Island Sound, and we walked out there to see if we could see the fireworks. We couldn't see the fireworks from New Haven Harbor there. We were there for maybe 10, 15 minutes, and we came back to our apartment and drove downtown to New Haven to see it. And I got back about 10 o'clock, and as soon as I got back, my landlord called me, and she lived across the street. Professor Williams, where did the gang come from? And honestly, I had no idea what she was talking about. I said the gang, and she's really hyper. The gang. All the neighbors have called me about the gang. And I said, oh, I honestly don't know what you're talking about. What gang? Yes, you had a gang of people on the waterfront. I said, oh, my friends were out on the waterfront. What did we make noise? No, that was not a problem. I said, but I just had a few friends out there. Remember, several of these beach houses are rented to Yale graduate students during the academic year. And it's not unusual to have 40 kids out there drinking beer on the waterfront some evening. So there was nothing unusual here. And I kept saying, I don't understand. She says, it was just too many. When your brother-in-law, your brother and sister-in-law and their 2 kids come down, that's fine because that's 4 people. But then this was 9 people on the waterfront. That is too many. It was just too many. So I give those personal experiences. I could have many more, but just to illustrate that I have experienced in my own life the stress engendered by these incidents of race. And I thought we needed to capture measures. And one important point, I talked about 2 fairly dramatic events. The scale that I developed that has produced the strongest results is a scale that just captures the little indignities. You're treated with less courtesy and respect than others. You receive poorer service than others in restaurants or stores. People act as if they think you are not smart. People act as if they are afraid of you. Just those little indignities. And what the research finds, there have been almost 500 studies now from around the world using the everyday discrimination scale. People who score high on everyday discrimination, more likely to get breast cancer, have higher levels of inflammation, more likely to have high blood pressure. Pregnant women who report everyday discrimination high, more likely to give birth to low birth weight infants. So there is one study that looked at a sample of people, actually there's more than one, that looked at a sample of people, followed them over time. If they score high on everyday discrimination, it's an independent predictor of premature death. They are more likely to die early because of the stress of discrimination. So yes, discrimination is real. It matters profoundly for health and also for mental health. I've given the physical health outcomes as well, but it also matters profoundly for mental health. So all of us should be aware of it and think of what we can do to make a difference and to support people who have had these experiences.
Absolutely. Thank you so much. And also thank you for sharing your own personal experience with this too. We got to hear briefly from Dr. Anderson on that as well. We all have skin in this game, melanated skin in this game. I also was born and raised in Southeastern Connecticut. So your stories just directly reflect some of the same experiences that I had with my family. As somebody that's been writing a lot about racism and posting about it and looking at the cultural conversation, especially over the past 4 years, I recognize that a lot of the ones that we see, incidents of racism, tend to focus on the interpersonal, which is what you were talking about before, the ways in which we're treated because of how people perceive our racial ethnic identities, and how that has a detrimental impact on our mental health. But what I found is that we can do a lot more to also educate our communities that racism is not just something that appears interpersonally and harms our mental health in that way, but is an institutional and systemic epidemic, right? That's also affecting that. So from both of yours experiences, I'd love to hear, how do you address some of these structural barriers that we see in relationship to race? And or also, how does racism show up? So give us a couple of examples of how you see that and what you're doing to address it.
Dr. Riana, you want to go first and I'll jump in after?
Sure, even though I feel like you're gonna just like eclipse me, but that's okay. I'll get us started, Dr. Williams. And can I just say again, what an honor it is to be on a call with such a giant in the field. Again, he just indicated creating the measures that we are able to use. So I benefit wholly from what he's doing. And so one of the things that I know he has done and he's been able to do in his work is to think about this public health perspective, this systemic, this larger perspective. So for me, benefiting from that, saying, okay, let's work across levels. So we have people at the systemic and structural level. I'm trained as a clinical psychologist. So I think about the individual and interpersonal much more than I do the structural. And the way that it actually shows up for me is that as I think about individual level incidents, which are discrimination, right? So that behavioral expression of racism being the larger structure of how one treats races differently and orders them. So if racism is that umbrella, discrimination are the tines in that umbrella. What are the ways that those things show up in everyday life, right? So if we understand that there's a structure to it, and we know that it shows up individually and interpersonally, one of the ways that I think about how do I take it back out into these larger spaces, given my training, is the implementation. So again, if I can create a therapy, right, which we've done, if I know how to do it in a therapeutic space with one family, how do I bump that up to 100? How do I bump it up to 1,000? In the development of this app, how do we get it to 1 million plus, right? 21 million. Like our goal is for every single young person of color in the United States. How do we get this app out to them? So that's the way that we're thinking about the structure. We still work at the level of the individual, right? If Dr. Williams thinks about residential segregation, the housing, like that's how we can get into homes with every person and think about how do we restructure the United States. That's not the level of my work, but my work is able to get to every single person in that home or every single person with a phone. How do I take the findings that I know that talking about race and racism and incidents of discrimination are incredibly important? How do I take that down to the level of every family, of every child, of every therapist? How do I get it to them? That's where technology, and again, some of the things that you all are doing right now can actually reach the scale that we need to make a difference in this country.
Yeah, thank you so much. You are so right. And I think one of the important points is we don't need to think of either or. Both levels are important. What's happening to individuals on a day-to-day basis is shaping their life, shaping their quality of life, shaping their ability to work and to live and to take care of their families. So it is important, the work at the individual level. But yes, we have to step back and think of what are the upstream mechanisms and processes that drive that. And back in 2001, I wrote a paper with one of my former students, Dr. Chiquita Collins, where we said racial residential segregation was a fundamental cause of racial disparities in health. That if we look at the differences in health, yes, there are lots of things that happen at the individual level. There's poorer quality care, lower levels of access to care, and there's a range of factors. But the big factor is, where do people live? And the opportunities to be healthy in the places that people have in their homes and neighborhood contexts. And in the United States, we have a history. We have a history of redlining, where banks and real estate companies would determine some neighborhoods that were desirable and some neighborhoods were not desirable. And the undesirable one were redlined. And if you're on the other side of that line, then Black folk couldn't buy a house, and the quality is worse. And although that was a policy from decades and decades ago, the structure put in place still exists today. I want to share with you just a few studies and the findings of those studies to let you see just how striking it is. William Julius Wilson and Robert Sampson were two of America's most eminent sociologists at one time. They were both faculty at Harvard University. They studied 170 largest cities in America and said because of segregation, there's not even one city in America where whites live under the same conditions as blacks. And that the worst urban context where whites live is better than the average context of black communities. So access to opportunity, access to quality schools, to good quality housing, to safe places to walk, to green spaces, all vary dramatically by the place in which you live. Let me give you an example of another study. David Cutler, Harvard economist, did a national study of Black and white young people making it in the labor force. And he showed statistically there were big differences in their success. And he showed using fancy econometric models I cannot even fully describe. But he's able to show statistically, if you could eliminate residential segregation in America, you would erase Black-white differences in income, in education, and in unemployment, and reduce Black-white differences in single motherhood by 2/3. All of these striking differences in income, education, unemployment are driven by opportunity at the neighborhood level. One more study, one more Harvard economist, Raj Chetty, has done an amazing study. He did what is called an intergenerational analysis. He looked using data for the entire country of the United States, the census data for the entire country. And what he asked the question, let me just compare Black boys who begin life in the same, in households with the same level of income. So he's not looking at Blacks and all whites. He's just looking at Blacks and whites who begin, their parents have the same household income. How are the boys doing in the next generation? And do you know what he found? In 99% of census tracts, that's census areas in America, Black boys have lower earnings than white boys, even when they started out life at the same place. Why? They're lazy? No. They're not working hard enough? No. They live in neighborhoods that differ in access to opportunity. What he found is that Black boys do as well as white boys when they are in neighborhoods with good resources, but that was true of only 1% of Black boys in America. So what I'm saying, the evidence is clear. If we're going to really tackle racism at its roots, we have to do things at the interpersonal level, but we have to think of how do we create opportunity at a neighborhood level where we live and the quality of schools our children have access to, because those are the drivers. Those put people on, think of them putting them on a treadmill or on an elevator that's going in the wrong direction in terms of access to opportunity.
Yeah, wow. Wow. Thank you so much. I hope we can get some of those studies that you mentioned into the toolkit if they're not there already, or at least make sure that more people read them. I cannot wait to read them after. When we have this, when we know that this is such a pervasive part of our society, the way in which racism on an interpersonal to the systemic level affects us, I think we have a responsibility to ensure that people of color that are impacted by this aren't forgotten in conversations around mental health. We know that a lot of the mental health resources that are out there might not reflect the breadth of lived experiences and can sometimes exclude the voices of marginalized people, particularly those impacted by racism. And so I'd just love to, for our last question, before we open this up to the audience, both of you, how do we do that? How do we continue to ensure that we as creators, as we're creating resources, sharing them to our audiences, ensure that we're not leaving those voices behind?
I'll let Rihanna go first again.
You keep trying to do this to me, Dr. Williams. Okay, so
I have the utmost respect for you and for the great work you're doing. And the thing that gives me hope in my career, as I come towards the end of my career, is all of the young people like Dr. Riana, who is doing amazing work. It tells me the future looks bright.
They say that, and then they make us do all the work. It's okay. Thank you. Just kidding. Thank you so much, Dr. Williams. Nicole, I think I know that we're going to tap into this too. We've got some great audience questions that are starting to come in. So I'll preserve some of what I was thinking with respect to that question, but for so long, we've heard one voice that has been reflective of an experience that was perceived to be universal. So if that was on the TV screen, if that was coming out of your textbook, if that's what was going into the training, there was this expectation that everyone saw the world in the same way that those writers, as those authors, as those researchers did. And for so long, those folks were of one background. Often these are white people, often upper or middle class experiences. And as we've already heard Dr. Williams share about, and I could literally give an example of Martha's Vineyard this past week, and a very similar example of what was shared about fireworks and excitement, right? And who's policing whose ability to have joy and to be in community. Once you start understanding that there are people who live differently, who have different experiences, that has evolved over time as we've gotten more folk of color in spaces like the Academy, or in what I love so much about the creative and creator space is that it's not the same regulation that we've seen, even though, of course, we know that there are algorithms, we know that some people are promoted more than others. We have the ability to speak up and to be unregulated in ways that for so long our training spaces where one or two of us could get into these PhD programs, these professor positions, we've been so regulated, right? So I say all that because in this new generation, there are so many voices, so many experts, so many studies that are coming out that say, actually, this one experience is not quite right. It's not fitting for everyone. It's not the same story for us all. And our voices do demand to be heard and deserve light. So one of the things practically that can be done, if you are a creator of color, certainly teaming up with other creators of color or folks across your identity can be impactful for you to amplify and to create a louder boom, right? And if you identify as someone of the majority or of privilege, certainly exercising that ability to say, I have a platform, I have a privilege that others may not, how can I boost them? That happened quite a bit during the pandemic when several people said, share the mic or pass the mic in spaces like Instagram Live or Twitter, right? Like, how do you use your platform to then highlight other people? What are the ways that you can feature someone's work every Thursday? Like, there are so many ways that we can group together or pass along so that other people's voices are emphasized. And again, I'll just summarize that to say, because that it hasn't always been the case, and it's going to require substantial and consistent change for that to actually impact this larger body of work, larger body of movies, larger body of information that's been out there. You can't just have one drop here, one drop there. It really requires an erosion of the structure that we have for people to be able to say, I've heard that story enough times that I think Dr. Williams actually did have that. And it wasn't just a one-off, that it can happen to my neighbor. It can happen to my friend, my colleague. It's a thing that happens to these people because of this thing. Like, once we have that story enough times, that's what happens. So again, just practically, I think we can join forces or pass along time and space to be able to ensure that those stories are amplified.
Yeah, that's wonderful. Thank you so much. Dr. Williams, do you have anything to add?
Yes, I thank you so much for what you said, Dr. Riana. It's very, very insightful. The point I would want to emphasize to the creators is that, we've been talking about this, we've been sharing the facts, we're sharing the evidence. A lot of Americans are unaware, do not know. We should not assume that people know the facts and they are rejecting them. There may be some people like that, not denying that, but there are a lot of people that do not know. So one of the things we have to begin with is to begin to tell the story. I receive an email from someone on what I would call on the political right. He has 85,000 people on his email list. And he sent an email out maybe a year ago in which he's mentioned all of the civil rights legislations of the 1960s. And he said racism has been illegal in America since the 1960s. There is no racism in America. And he is sharing that information, and there are people believing that point. Yes, there were legislations passed, but racism still exists. So we need to raise awareness levels, tell the story so that people realize this is real, this is happening now. There's a lot of science, there's a lot of evidence that documents it. The other thing that's so important is that we need to lift up success stories. We need to lift up solutions, both at the interpersonal level, but at even the structural systemic level. And I'll give you one example, not the only one by any means, but maybe just before the pandemic, myself and another colleague of mine, Professor Jack Shonkoff, we went to purpose-built communities in Atlanta, Georgia. It's a housing development that sits on the site of what was a African American public housing project where 90% of the residents were a victim of a felony every year. 90% a victim of a felony every year. And that public housing project has been torn down, a collaboration between the Public Housing Department of the City of Atlanta, philanthropists, and the local neighborhood community group, and they have built a new mixed income housing project where 50% of the residents are at market rate, 50% qualify for public housing. The school, 60% of the students qualify for reduced price lunch, so 60% of them are poor. The elementary school is one of the best performing, top 5 every year in the state of Georgia. So it's a dramatic transformation. And purpose-built communities is saying they will provide free technical assistance to any entity in the United States that wants to replicate their model. And there are many cities that are trying to implement the purpose-built model. I just cite that as one example of a success story of an intervention that is getting both at the interpersonal and at the upstream structural levels. And there are more examples like that. And we need to lift them up so that people feel we have a problem, but there's something we can do about it. And we are Americans, we are innovative, we can do things different, and we can give every person here a fighting chance to live the high quality of life that they would love to have.
Wow. Wow. First of all, thank you for sharing that case study. What a beautiful example. And then what comes with that a reminder that we can talk about the problems and the solutions, right? We can educate about what is and then help people reimagine what's possible. And so thank you for reminding us that. It gives us so much more space, I think, as creators, right? To choose how we use our stories and how we use our platforms to make an impact. We're going to move into questions from the audience. I have 3 so far. So if you are still listening and you haven't put your question into the comments, now is the time. And we're going to try to get through as many as possible. And so we're going to give a brief answer to each of them. But remember, you're getting a toolkit that's going to have probably more information than you ever thought possible, right? To help you not just answer some of these questions more in depth, but hopefully spark more questions that you can be in inquiry with yourself and with your peers. The first question that we got is, how do you understand or relate to the research in the mental health and mental disorder space when for decades it only included white cis men? How do you relate to some of this kind of like legacy research that's been done in the space? And I'll let either of you start.
I would say just a little bit, since I am a researcher who's done work on mental health and mental disorders in the United States. Um, uh, it's not just in mental health, in so many areas of medicine. If we look at the history and we look at the research, there are problems in how we define the research, how we did it. Even there are problems even with some of the technology used in medicine that is based more on the characteristics, the physical characteristics of one racial group versus another. So we need to acknowledge what we have done. We need to educate young people of the mistakes we have made so we don't continue to repeat them. And And on the other hand, the tools that we have in terms of mental health tell us the story of the challenges that different populations face. And the LGBTQ plus population, for example, in the United States, is one of the groups with one of the highest rates of suicidal ideation. And it's the rejection that they experience from being in this society. So I think the history of medical research has not been perfect, but even the tools we have today point us to the problem and can give us momentum to come up with solutions to address the challenges that we face.
I'll just briefly say, fear not, folks like Dr. Williams and the Program for Research on Black Americans, James Jackson, just giving him honor for his work. They have created tens of thousands of data points for us now to say, this is what's new, this is what's different, so we don't have to rely on that centuries long or decades long information that we have read about in our books that trained us. So we have an entire new generation of folk who are generating research that can actually speak to exactly what you were asking about. And frankly, I don't even use the methods that I was taught about comparative analysis, right? So even 15 years ago, the thing that I was taught was, do Black parents parent the same way as white parents? That's not a question I've even asked in the past decade once someone gave me liberty to say, do you have the data set that can just ask questions about what Black parents are doing? Then dive into that. So we have the data sets now. We don't have to ask those questions. We don't have to do comparative work. We can say, here's what we know about these excluded identities, families, populations, based on what we know. And now let's develop treatments. Let's develop the things that we need to do to actually support those folks, because there can be different lived experiences.
Yeah, thank you both. We have another question, and I go right into it because I know that there's probably more to come. And I really appreciate the sentiment behind this question. There's discourse that social media is great for educating youth on topics like racial discrimination and mental health, but constant exposure to the news can cause apathy and burnout. How can we balance these factors to use social media effectively for education and advocacy? And before I offer it to either of you to answer, I just want to name as somebody that is in the trenches writing about this work all the time. It's so important to start with what you need to take care of yourself. Create some kind of care plan for yourself that can help you day to day proactively, and then have a list of resources when you feel yourself getting to that place of overwhelm. And I just want to remind everybody here that's a creator who wants to take this work on, that it's not your job independently to change the entire world, right? You can only do so much with what you have. And I want you to remember that you're not the only person that's thinking about this. Look at our incredible panelists, remember that you're in community with so many other people that are doing this work. So do it from a place where you're as resourced as possible. Allow yourself to take breaks, and don't overburden yourself. How about each of you? What are y'all doing to take care of yourselves?
Yeah, thank you so much, Nicole, for your work and for spreading those important gems to the folks listening today. I want to offer a few more things based on some of my experiences as well. One of them most pointedly is the thought around videos, sharing videos. So we have, of course, started using CW or TW, content warning, trigger warning, et cetera, to let people know that something is coming. But as humans, our eyes attend to things that are moving. We are going to look at something, and even if we know, we see those two letters, it may not be enough to stop us from watching that video. And if it's autoplay, which is often what we're seeing on a lot of our platforms, that's going to be very hard to look away from. So the first thing that I will say is that I, as a researcher of racial trauma and as a clinical psychologist, do not watch videos out on the TV, on social media. And this happened because Philando Castile's video traumatized me so much. I was standing for an hour watching it on auto play that I could not move at a conference about Black psychology. Like it was the wildest moment for me. And I was so burdened by so much stress and trauma that I made the decision on that at that time not to watch those videos. So that means as you're sharing, you can be thoughtful around, do you take a still, right? Do you do it like a screenshot? Do you say maybe if it's, a second carousel or a second tweet rather than the initial screen? How can you be thoughtful around what you share versus automatically sharing something that, again, as humans, we tend to look at, we attend to. So that's thought one. Thought two is that there's such a conflict between what is good, what's bad. Is social media good for kids? There's a lot of books, research right now that's in tension with each other. But I think what we can say is that too much of anything is often not that great. And so, again, to Nicole's point, as you're sharing or as you're getting involved in it for yourself, if you're feeling any sort of tightness around your chest, if you're getting that headache, if you're feeling stressed about what it is that you're engaged in, you can always make the decision to take a step back. And so that likewise for young people, if you're starting to share quite a bit and you're wondering, is this going to be good for them, then you might be getting some feedback already that it may be too much at that time. So take the time to regulate both for yourself and for others what may be too much to give out in that moment.
I think there's a lot of wisdom in what you've just said. The other thing I would say that I think it's so important is that the young people growing up today, the children and youth growing up today, don't know a world without social media. So I don't think it's the case that we can eliminate social media from their lives. But parents and teachers and other adults in their lives need to enable them to how to manage it and how to control it. And the potential negative power of what kids are exposed to online can have dramatic negative effects. Professor Brandisha Tynes was a postdoctoral fellow with me many years ago. And at the time, we published the first paper showing that what kids see online in terms of discrimination affects their mental health. She has continued to do work in this space and find that African American and Latinx adolescents, for example, who witness a lot of cases of someone of their videos of someone of their own racial ethnic group being beaten, arrested, or abused by the police, within the next year, higher PTSD, higher depression linked to what they've been exposed to. One of my former students, Jacob Bohr, did this amazing study that I collaborated with him on, where he took a database of every police shooting in the United States and linked it to another database from CDC with the mental health of the population in every state. And what did he find? Every police shooting of an unarmed Black person leads to worse mental health for not the family and friends, the entire Black population in the state in which it occurred for the next 3 months. Police shooting of an unarmed white person, no negative effect. Police shooting if the Black person was armed, no negative effect. It's only the police shooting of an unarmed Black person that leads to that effect, suggesting that it's the perception that it was unfair, it was unjust, it was unnecessary, and that causes stress, not just for the family, but everybody, all Black people in that state. Their mental health is worse for the next 3 months. So again, I think what I would say is the technology is with us. We need to learn to manage it and use it in ways that enable and help us to flourish, and not in ways that are having negative effects on our health.
Thank you. Thank you both. It's something we really have to keep in mind because, like you said, Dr. Williams, like our relationship with social media isn't going anywhere, right? And the ways in which that we increasingly find news, the get information, get access to community. There's so much goodness and richness that social media can bring into our lives, and we have to be really careful on how we hold these conversations. We have one last question I'd love to put to each of you briefly before we close. And Dr. Anderson, I'd love to start with you because you had kind of brought this up earlier. The question is, I want to discuss this content more, and I've been told to center Black people and people of color as I do. Do you have any advice on how to appropriately center Black people on my very white lived experience page that doesn't co-opt their space?
Yeah, I mean, authenticity is the first word that comes to mind, right? So within the therapy that I've developed called Embrace, which is where we have therapists who talk to young people and their families about race and racism. The first question that we had was, can we put white therapists who are 65% of the workforce into this space? And the answer was, one, we have to, because we have to make sure that white people know how to talk about race and racism with their clients. But two, logistically, there aren't enough Black people to go around to talk about this. So it may be a bit different with what we're saying here with content creation. But what we can say is that what we learned from that work is that as soon as that white therapist went in and said, hey, I'm white, I know that I'm not going to fully understand your experience, but I'm here for you. I want to hear it. And I want to make sure that you're free to share it with me, right? So I think very similarly, you can go in and say, this is what my content is typically. I want to make sure that I'm reflecting some of the voices that I'm hearing in this space that can be amplified. So I'm going to cede this time, this space, this page, this post to this person. I'm going to lift up their story. I'm going to stitch them in, whatever it is that you need to do to say, not me, but this is important. Here you go. Sharing that spotlight is really what matters. And to be authentic doing that, in my experience and in my research, has been the most important thing, not your skin color.
Well put.
I honestly do not have much to add. That is a brilliant answer, and it captures it well. It's just being honest. Sometimes people feel if you say that, people wouldn't want to listen to you. No, that opens the door. You're human, and you are acknowledging what you know and what you don't know. It's brilliant what you said. That's exactly what we need to do.
Absolutely. Thank you both. I mean, thank you both for joining this and sharing your insights and your knowledge. Because like you said, we have to have these honest conversations. We have to normalize conversations around this. It's the only way that I think we can create more momentum about creating some comprehensive change. And so thank you so much to all of you that are listening as well for your thoughtful questions, for your patience with us as we got started. Again, I just want to reiterate that you're going to receive an incredible toolkit that will have everything here. So keep your eye on your inbox for tomorrow morning. That'll have all the resources based on today's discussion. I also hope that you continue to join, us here at the Harvard Chan Center for Health Communication for these kinds of conversations. So we can be a resource to you. Join in for future webinars like this. Share what other topics you're interested in hearing from the organization on. Is there anything else? Any other last thoughts?
Well, I just want to say thank you for taking time out of your schedule. You had to prioritize this to be here. This is such an important topic for so many in our society. So thank you for joining, and we remain a resource to help you so that you can reach those we cannot reach, and we appreciate all that you do.
Yes, I love that, Dr. Williams. And I'll thank Nicole sincerely for your moderation and your time. And also just want to, from this humanist perspective that we've been talking about all day, listen, like, we created racism so we can end it, right? It's that simple. Like, it is not something that has to be with us forever. If we built it up, if we constructed it, then we can take that thing right on down. So it's not enough for us to, again, pass the buck along or to kick the can down the road. We can actually stop it in its tracks. Let's be the ones, y'all.